Chatham-Kent has 137 cases, and Sarnia-Lambton has reported 230 cases. Michigan now has 52,350 cases, with 10,417 cases being in Detroit. Today, we are reporting 805 cases of COVID-19 in our community, an increase of 11 cases from yesterday. 37% of our cases have occurred in long-term care homes and retirement homes, including both residents and staff. 455 cases have resolved. 22 people are in hospital. 17% of our cases are between the ages of 20 and 29. 15% are between the ages of 30 and 39. 15% are between the ages of 50 and 59. And 19% of our cases are 80 years and older. 43% are male and 56% are female, and 1% is unknown at this time. Our community has lost a total of 63 people to COVID-19. 47 deaths have occurred among residents in long-term care and retirement homes. 3 long-term care and retirement homes have come out of outbreak. Our health unit is currently working with 14 long-term care and retirement homes that are in COVID-19 outbreak. Testing for COVID-19 is based on a clinical assessment. Testing should be considered even if you have one symptom. Common symptoms include fever, a new or worsening cough, shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsor-essex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Ouellette campus. Please note that testing is now available for people who have even one symptom of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. Thank you for joining us. Yesterday, we rescinded outbreaks for 3 additional long-term care home and retirement homes, bringing the total number of outbreaks we continue to monitor down to 14 from 18 last week. It is very encouraging to see some of these facilities starts to come out of an outbreak. It takes a lot of work and coordination between the homes, the health unit, other healthcare partners, families, and residents to move a facility out of the outbreak. Yesterday marked the reopening of a number of facilities and public spaces under the Stage 1 plan. These announcements are a big step forward, and to be successful, we'll need coordination, patience, and persistence. Some of the places reopening include outdoor sports facilities and off-leash dog areas, retail shops not part of a mall and have a separate street entrance, golf courses, and marinas. Dr. Theresa Tam, our Chief Public Health Officer for Canada, recently coined the hashtag #GoingOutSmart to remind Canadians to continue to practice and follow public health guidance as they venture outdoors and into public spaces. When going out and accessing public spaces, remember to follow public health recommendations, especially wash your hands regularly and thoroughly with soap and water, or use alcohol-based hand sanitizer. If you are going to any business establishment, wash your hands or sanitize your hands before entering the store and immediately after leaving the store. Within the business establishment, avoid touching anything unless you absolutely have to. Cough or sneeze into the sleeve or a tissue. Keep surfaces clean and disinfected. Avoid touching your face with unclean hands. Maintain physical distancing of 2 meters at all times. Wear a non-medical face covering in settings where physical distancing cannot be maintained. And most importantly, stay home if you are sick and contact your healthcare provider. I understand that people are anxious to get out and interact, but we need to take things slow and continue to practice due diligence. Remember that social gatherings are still limited to no more than 5 people. This is to reduce the number of close contacts. It is safest to limit your close contacts to those in your household. However, if residents are interacting with others, I recommend that you maintain physical distancing, wear a non-medical face covering if physical distancing is not possible, and limit your social interactions to a small number of people. I know that our community has a lot of questions. The Windsor-Essex County Health Unit will continue to update our website, our frequently asked question page, and other information to ensure you can access the information you need. Businesses that are reopening or preparing to reopen should consult the Ontario website for reopening and their sector-specific associations for more detailed guidance. As well, business and individuals can email or call the health unit with questions. We have also introduced a new way to ask questions on our website. Starting this week, residents can ask questions and the Windsor-Essex County Health Unit will answer these questions. We will also share some of these questions during our Facebook sessions. Thank you.
This is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Good morning. I noticed Heron Terrace has people in the 60s with confirmed cases. Does that mean it's taking longer for them to recover, or is it that more people are getting confirmed cases within that facility?
The Heron Terrace and all the facilities that are currently listed under the outbreak, so they are not meeting the criteria for having 14 days of no new case in the facility. So anytime that happens, that keeps the facility under outbreak. So any facility that is currently on our list of outbreak, they are not meeting that criteria. That means they are having cases in the 14 days time period, which suggests that there's an ongoing transmission happening, and we are working with all these facilities to ensure that they can reduce that ongoing transmission and come out of the outbreak as soon as possible.
So we had more businesses open up yesterday. Did you find that to be successful so far?
We haven't heard any complaints per se, other than there's big lineups everywhere, and our staff will be following up on any complaints, and we'll be doing some proactive visits to these establishments to make sure that they're all compliant with the Emergency Management and Civil Protection Act.
Okay, thank you.
Any questions from Blackburn?
Yeah, after you made the announcement yesterday that you would be testing people with just one symptom, did you see a big uptick in people going to the assessment centers?
Well, it will be too early to say that. I think it takes time to show the impact, because in any case they need an assessment, and people have to have symptoms to go there. I think the time will tell. Maybe in the next couple of days we'll have a better sense.
Any questions from CTV?
Now that there's 3 homes that have been resolved, right? So now you're down to 15. I guess my question would be, what's next for the LTCs as those numbers start to dwindle and we get closer to 0? What's next for them?
So I think the key piece in fight against COVID is prevention. So the best thing that we'll still need to do, even for those homes that are coming out of the outbreak, that they need to have those measures in place to protect or reintroduce COVID in their facilities. We know many of these residents do not go outside, and with further restriction on visitors, the key piece would be staffing, and then the staff, how they are conducting themselves and how they are spending time outdoors. And when they're coming to the facility, are they following all the right IPAC measures? Are they wearing the universal mask, which is a requirement in all of these facilities? Are they using the appropriate PPE when they're caring for people? Are they washing their hands after caring for one patient and going after to another patient? So all these measures will be critical to ensure that these are not reintroduced. So we are working with all these facilities to make sure that we have a constant ongoing discussion on these measures and ensuring that the facilities have all the information that they need, because at the end of the day, we're not there 24/7. It's the facilities that they have to make sure that they are implementing all these measures and have a good system in place for their staff to follow those measures. And that's what we are hoping that with all these proactive work and now clearing them out of the outbreak, it should give them enough to continue to just work on what they're doing right now.
Okay, and then for the social piece too, social gatherings, wear a mask, 5 people. How do you determine who you should allow in your circle?
Yeah, so that's a good question, and I think that's why some of the things that I said that ideally it should be your family, your immediate family, and right now the limit of 5, it's if your family size is already big, and then it doesn't matter for your own family size. But anyone who doesn't live at your home, I think that's still a big question, that whether you should be meeting them. If you need to, I would still say that follow the 5 people guidance, and also ensuring that physical distancing is maintained as much as possible, and wearing a face mask when you're making those trips. But if you have an older parent or a grandparent who would be at a higher risk, I would request not to visit them. I would request people to use virtual means to stay in touch with them.
Any questions from AM 800?
It appears that the number of deaths is slowing down. I don't want to jinx that at all. Given that we've had 3 long-term care homes that are no longer an outbreak, is that connected?
Can't say for sure, but I think obviously we know that many of these individuals in these facilities, when they're dying, they are older individuals, and any kind of illness puts them at a higher risk of dying. And if the homes are coming out of the outbreak, basically that means that they do not have any symptomatic residents. And if they do not have any symptomatic residents, the risk of dying would be low. So I don't want to say that it's entirely connected, but obviously it does play into some factors that if you have lots of homes under outbreak, that means there are many more symptomatic people, and the likelihood of them dying would be high. So from that perspective, yeah, we can say that the more and more long-term care home coming out of the outbreak, it's a good sign that people are recovering, and as long as they do not have new cases, we should be in a better shape.
I know you don't set these guidelines, but I know a lot of people are wondering how I can have a house cleaner come into my house, a babysitter come into my house, but I can't have my mother come into my house. Do you have anything to say to that? And I know you don't set those guidelines.
Well, I personally, I would not recommend having anyone who doesn't live in your house to come into your home. It's just common sense, and I think it's everyone's situation could be different. There may be people who may not have the ability to clean their own home for any reason, either because of a disability or for any other medical reason, but that work need to happen. So I cannot say that this could be the reality for everyone, but people should be mindful that if you don't need anyone to come to your house, that's the best way to protect yourself and your family. And I would hope that people will use common sense and use their best judgment before they start inviting other people inside their homes.
Thank you.
Any questions from Windsor-Essex?
Good morning. Just wondering what the criteria is for an outbreak at a long-term care or retirement facility to end. Is it just no new cases, or those cases have recovered, or is it they're no longer contagious?
So a combination of both. So typically the easiest way to say that is for 14 days straight, if there is no new onset of symptoms or no new case in the facility, it would be safe to assume that there is no transmission happening in the facility, because all these residents in these facilities are being monitored for their symptoms, they're being checked for their temperature. So any new symptom onset can still keep the facility under outbreak until we get a result back. So for example, for the whole 12 days, let's say, they don't have any case, they don't have any new onset of symptom, but on day 12, someone develops cough and fever. And then that puts them into a list of new onset of symptom, and then that person needs to be tested. If that person result is being awaited, it can still take more than 14 days for them to come out of the outbreak. But let's say on day 15, we get a negative back, that facility can come out of the outbreak because they met the criteria for no new case of COVID in the last 14 days and no new onset of symptoms that is suggestive of COVID, so they can come out of that outbreak.
Any questions from the Windsor Star?
Dr. Ahmed just answered it.
Okay. Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
CTV?
No, thanks.
AMA 100?
I'm good, thank you.
Windsorite?
No, thank you.
Windsor Star?
No, thanks.
Thank you.
Okay, thank you.